Good morning. A debate is taking place in Parliament today on whether the right to maintaining contact with loved ones in care homes needs to be guaranteed now the pandemic is over.
Access for families is currently recommended by the government, but campaigners have warned that individual homes are imposing their own restrictions.
So let's get a reminder of the situation as it stands. Back in March this year, all COVID restrictions on care home visits were lifted.
Current guidance from the UK government states that if there is a COVID outbreak where there are 2 or more positive tests, care homes should try to ensure visits can still happen in all circumstances.
Each resident is allowed 1 visitor, but this doesn't need to be the same person throughout the outbreak.
We can talk now to Joyce Pinfield of the National Care Association and to the West End actor Ruthie Henshall, whose mum Gloria died in a care home in May. Let's speak to them both now. Ruthie, good morning to you. This is a story that's very dear to you, isn't it? For obvious reasons. The thought that someone would be trying to visit their loved one and would be prevented is heartbreaking.
It's devastating, and it's devastating to hear that it's still happening. And that is, we're all being asked to live with COVID now, and everybody in care homes is vaccinated. It is absolutely essential that their mental health is looked after, and not just, what's going on with them and COVID. This is crazy that all these months, years later, nothing has changed, and care homes are making up their own rules. And this is just devastating to someone like me and many, many, many families who've lost loved ones, and they basically died of loneliness.
Ruthie, what kind of stories have you heard of people who have been prevented?
Basically, what's happening is the situation was exacerbated by COVID, but it's not exclusive. People are banned from care homes. They're even raising concerns. One of the things that really was devastating to me was to know that I had no say over my mother's health, that the care homes did. And this is just crazy. So to have one person that they can have come in and be their eyes and their ears and their memories, because nobody else knows them like we do. And care homes should not be making up their own rules.
Joyce, Ruthie has said that twice now, care homes making up their own rules. Is this happening? And are you able to keep track of what's going on in all care homes across the country?
Of course, we can only really speak for what we know about our local knowledge and also our members through National Care Association. As far as we know, we don't know of anybody who is definitely not allowing visitors into their care homes. Of course, many care homes are back into COVID measures. We all have to follow the guidance that comes out from the government and also from the local Public Health England guidance as well. We have to remember as well that we have a duty of care to all of our residents and our staff, that we have to make up the visiting guidance for our own environments and our own situations.
But there's guidance on the one hand, and guidance might mean masks, for example. It might mean restricting visits to 1 or 2 nominated people. But certainly anecdotally, some care homes are banning visitors altogether, and there is nothing really to protect the rights of families or loved ones in that situation. We know in Scotland they did introduce legislation to compel care homes to allow visits. That doesn't exist in England, should it?
It's a very difficult situation when you're not covered by insurance policies. Every care provider will try to make the best possible and do everything possible for their residents and for their staff. So the guidance is very clear. It is there that we should be allowing people to have visitors, but we do have to also put that against the environment. So if we do have an outbreak, people are allowed 1 visitor. And so we do have to try and ensure that all infection control measures are put into place, such as even testing of visitors. And we do ask that if visitors are going to come, if you have any symptoms of any illness that could be transmissible, please do not visit your loved one.
Joyce Pinfield, I'm sorry to interrupt. If I'm understanding what you're saying correctly, Supposing I go to visit a loved one in a care home today, and when I get to the door, they say, no visitors today. And I say, well, I have a right. I have a right to go in to see my loved one. I'm on my own, it's just me. Is there any reason why I cannot go in? Do I have a right? Do I have the right to go in as one individual to see my loved one?
It is a very difficult situation, and of course they should be asking the care home why they can't go in.
Well, and no, my question to you, that's why I asked my question that way, if I could, Joyce. I'm sorry, just trying to get to the clarity on this. Is there a reason? Because a moment ago you said if there's an outbreak, you can have one visitor. So in what circumstance can they not allow anyone into the care home?
There could be many circumstances.
Like what?
There could be if the person is undergoing personal care at that moment in time. But
so I'll wait 20 minutes and I'll go in afterwards. Sorry, Joyce. In that circumstance, yes, I'll wait for an hour and I'll go in afterwards.
That type of instance. We can't envisage every circumstance, of course we can't. But in general, people will be allowed to go to visit their care homes. There's always exceptional circumstances. And of course, if it is a general policy, then everybody should be informed. All visitors' relatives should be informed if that policy has to be enacted for any reason at all. We do have to protect all of our residents, but the guidance there is clear that we should be allowing visitors in.
But it would appear that the guidance isn't enough for guaranteeing visitors' rights. I just want to read this tweet that we've had through to you, Ruthie. This is from Helen, who's tweeted BBC Breakfast. She says, I'm having the same issue with my mum in her care home. The home has currently stopped visits as COVID rates are rising in her area. I test every time I visit and wear a mask. So why stop my visit? Hashtag angry, upset, missing my mum. And I guess these are the kinds of stories that you're hearing all the time.
Oh, my goodness. And this is what's terrible, hearing all the time. I mean, guidance means nothing. Absolutely nothing, because they're still, as I said, making up their own rules. And, you know, I waved to my mother from windows and she cried behind her window because she couldn't understand why I couldn't come in. Now, this is still happening. I mean, I don't think Joyce came up with any good reason why people can't go in. We're asking for Gloria's law, and we're asking for one essential caregiver, just one, in situations where there's an outbreak, or that going forward, nobody will ever have to be on their own again. It is devastating. My mother, when I finally got in, she sobbed in my chest. I just held her and she sobbed and sobbed and sobbed. Is this a basic human right that should be given to all people, is to have the love and care? She couldn't talk, she couldn't walk. All she had was my touch and my memories of her. This is a basic human right and it's being denied. It's so, so wrong.
Joyce, can I ask you a very straightforward question? As Rachel was saying, there are people literally messaging us while we're talking to you who are not being allowed to see their loved ones. If that's happening and you are told, either by us or someone else, the name of the care home and the date that it happened, what will you, as an associate, what will you actually do?
We would very much like to hear of any care homes that are being denied visitors and the reasons why, and then we can try and assess the situation as to why. But of course, the situation is, if you are in an outbreak and you are possibly only allowed one visitor, then it may be very difficult, because people have many more people in their family who will be wanting to visit. So that could be the situations that you are hearing of, where possibly, if they're in outbreak mode, that they might only be allowed one visitor per resident, which is a very sad situation. We do have to remember that over the last 2.5 years, at the beginning, 2.5 years ago, we were just facing this. We did not know know what we were facing at all. We have greatly moved on from that time. All care providers have got very high infection control measures. We're not only asking visitors to wash their hands, but still to wear masks, particularly in communal areas. And so we have moved on. We have adapted our environments, made more private areas so that people can have visiting in a private area so they are not bringing any infection into the rest of the care home.
Joyce Penfield from the National Care Association, thank you very much. And Ruthie Henshall, thank you for your time as well. I'm sure it's a subject we will talk about again.
Do you know, the Care Quality Commission, which oversees care homes excuse me, in England, have said this about this whole issue. They say the Department of Health and Social Care released guidance in March, updated in August, which lifted visiting restrictions in care homes. Our expectation remains care homes follow this guidance. Where concerns have been raised with us in relation to visiting, we have taken a range of actions. We ask mandatory questions on each of our care home inspections, which also look at how visiting is being supported in a safe way. Just one other tweet as well from Catherine, who says, this is the problem, the rights of the visitor trumping the rights of the care home residents. Are all visitors testing before a visit? Are they illness-free? We are in cold and flu season. So there is a delicate balance to be struck sometimes, for sure.
7:43 is the time now. Holly's got the sport for